I'm Sue Dyson, and in this session we're going to discuss the investigation of episodic lameness, lameness that comes and goes in an apparently spontaneous way. And this can be a challenge for investigation because when we're presented with a horse, it may be at a time when lameness is not apparent. So we have to ask the question, why might lameness only occur intermittently? And there are a number of different possibilities. The pain could be genuinely intermittent in its nature. Alternatively, an owner may not be aware of restrictions of gait which reflect a bilateral forelimb or bilateral hind limb lameness, but they are aware of occasions when one limb is more painful than the other. The owner may assume it is always the same limb, but that's not always the case. The pain may be related to work intensity and duration, and lameness may only be apparent at high work intensity or long duration. And this is particularly true with endurance horses competing at the upper levels. So there are key facts that we need to acquire from the history. How frequently does the lameness occur? And has the frequency of occurrence changed over time? When present, for how long does the lameness last? And does it completely resolve or progressively improve, but some low-grade problem may persist? Is the lameness influenced by head and neck position? Does the horse stand in a normal posture when lameness occurs? And are there any other clinical signs noted during the period when lameness is present? Is there any pattern in the lameness related to work type, intensity, or duration? Are there any other associated clinical signs, for example, a lowered head and neck position and reduced range of motion of the neck as seen in the image on the right, or stumbling, or dermatomal sweating, all of which may be suggestive of a neck-related problem? Is the horse otherwise performing normally, or have there been any other alterations in the horse's performance? Has there been any change in the horse's posture? Has there been any change in the level of work which the horse is being asked to perform at? And has the actual performance changed in any way? Can the lameness be reproduced? Or is it necessary to arrange to examine the horse on the day of a competition or the following day? Is there video footage of the lameness available, from which we may be able to make some educated guesses as to the source of pain causing lameness? I think it's always really important to bear in mind that if lameness varies spontaneously within an examination period, interpretation of the results of diagnostic anesthesia can potentially be misleading, and I'm going to show you an example of that. Is there a role for skeletal scintigraphy, or are the results at risk of being misleading?